Hello, 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 hello. It's good to be back here for my second episode. Woo woo! Now, for those of you that are new to this channel, welcome. For those of you that are returning for the second time, hello again. I am excited. I am thankful. I am grateful. Look, y'all. I saw my one subscriber last week and I was like, oh my God, yes, 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 yes. Yes, I celebrate. It may be small to somebody else, but baby, it's big to me because it's a start and it's going to grow. And I am excited because I am doing this from my authentic, my most realistic, transparent self that I could possibly be. If you know me, you know me. So thank you to my now 6 subscribers. Yes, I now have 6 subscribers and I am very excited about that. I am celebrating every single moment because why not? Why would you not celebrate you? Why would you not celebrate yourself? Celebrate yourself, Kim. I am. So that's out the way. I want to say, for those of you who are like, who are you, girl? We don't know you. You know, hi, I'm Dr. Kimbrough-Edwards, and I am bringing you clarity on this particular channel. I deal a lot with mental health. I am a mental health advocate. I hold a doctorate degree, a professional degree. You may say, girl, who care about all that? I do. I care about that because, again, this channel is all about celebrating you, celebrating me, celebrating us, big, small, whatever. Everything is important when it comes to our life and the things that we think about, the things that, the spaces that we choose to live in. It's important to us. So I am all things life. So welcome again. For those of you who would like to know more about my personal background, my story, my trauma, you can go to my website, which is thereislifeafterlife.org. You can also make sure that you subscribe to this channel so you can stay up to date when you ring the little bell. It'll keep you up to date on, when I do post videos so you guys can know, what's going on, what you talking about today, because I'm not just here just be like, okay, girl, let's just, or hey guy, hey you, hey them, hey they, let's just sit and have conversation about nothing. No, I'm actually talking about some things that you can actually apply to your life, because again, I'm all things life, marriage, relationships, family, school, career, all things life. That is me. I am bringing you things that pertain to all things life. This particular channel, again, is about bringing you clarity. So we focus here on mental health. We focus on therapy because that is my background. That is my new career as a therapist. And so I'm excited about that. But I don't want to waste nobody's time. Today, I'm not in my my work gear, getting ready to go meet with a client today. I'm actually off today. I, have this day off. The good thing about being a therapist is that you set your schedule. You align your clients how you need to align your clients. So that's a good thing about that. But I did go work out. And as you can see, I still have on my workout gear. This was my self-care for myself. We'll talk about that a little later. But again, for those of you who have watched and who was with me for my first episode, we talked about trauma, all things trauma. And I told you that I would come back to you to give you some strategies and a little bit more insight about trauma, what that looks like, how to process it, and also how to heal from trauma. Because you, believe it or not, you can heal from trauma. It takes work, but you can heal from trauma. So I wanted to share with you, there are some things that, some strategies rather, that I have not only used for myself, but I've used on clients from the past, that when I first started getting into counseling and being able to provide help and services to individuals who have been dealing with some form of trauma, I decided to sit down and just come up with some strategies and some actual steps and tools that they themselves, resources that they can use to help them process the different types of traumas that they have gone through in life. So I'm going to share a few of those strategies, those tips with you today. If you have not watched the first episode, go back and watch the first episode and you can catch up with the rest of us, okay? So today, I'm going to talk about childhood trauma. And again, every traumatic experience doesn't just come from your childhood. It can come from you being a teenager. It can come from you being in college. It can come from you being an adult. It can come from something that just happened on yesterday. Okay. It's some trauma. We talked about what trauma is. We talked about what that looks like. We talk about, the different levels of trauma. And so today I want to talk to you about some strategies. So again, if you have dealt with some type of trauma, I want you to ask yourself a question. Strategy number 1. Can I change what happened to me? Talking about trauma. We don't want to live in this space where we're angry, we're bitter, we're taking it out on other people. We can't be in the same room with the person or the people who caused the trauma. We can't go to the place where the trauma happened. We're talking about those things. Can I change? Can I change what happened? Can I go back to last night and make last night not have happened? Can I go back to last year and erase it and it never happened? Can I go back and change it? Can you go back and change it? Ask yourself that question. That is the first step of dealing with trauma and going through the steps of processing trauma. Ask yourself the question, can I change what happened to me? You answer that for yourself. I won't answer it for you, but I have already answered that question for myself. The next one says, I'm going to skip down to this one. It says, when I or if I see them, her, him, they, do I feel ashamed? Do I feel embarrassed? Do I feel guilty? Do I feel afraid? I asked myself that question because something happened to me when I was a child, and even as an adult, when I go around the particular person, I feel some type of way. Now, I'm not taking my emotions out on the person, but it bothers me to be around the person. Like, I'll see the person, I'll speak, but I'll try to go sit somewhere away from the person. I'm not going to sit there and have a conversation with you because I'm still dealing with what you did to me. Trauma. So when you are around that person, when you go back to that place where the trauma happened, it could have been you witnessing somebody that maybe it was a close friend, maybe it was a loved one, maybe it was a parent, maybe it was a child, maybe it was I don't know, it could have been a teacher or a neighbor or something, but you may have witnessed that person maybe jumping off of a building and taking their life. Trauma. You witnessed that. When was the last time you've been back to that place? Are you able to go back to that place? This is trauma. And as a therapy, let me just help you understand. You may say, well, why would I want to go back to the place where I saw somebody jump off of a building? Or why would I want to go back to the place where, I was raped or where I was molested? Why I want to go be around this person that did this to me, or why would I want to go back to the job that fired me, that that set me up? Why do I want to go back to that place? As a therapist, we have different approaches to our clients, right? For somebody that may have dealt with what we call post-traumatic stress disorder, PTSD, we think about people, we always say people that may have gone off into the war, right? Because they see a lot, they experience a lot. And then when they come home, it's like that person doesn't seem to be the same person before they left. You can have PTSD from a relationship that you may have dealt with, that was, every day it's just like you have these memories, you have these thoughts that are plaguing your mind, And so as a therapist, the approach to something such as PTSD, it could be cognitive behavior therapy, right? Where we're working with you on how you process your thoughts, the way you think, your behavior. That's what we call cognitive behavior therapy. That's what that's for. We are working with you on changing the way you see things, changing the way you think about things, changing, your behaviors, how you respond to that actual traumatic experience, the PTSD. Some counselors who are, you have to be a specialist or certified to be what we call an EMDR. That is what we call eye movement desensitization response, EMDR. That is for someone who, a therapist, but you have to go get the training, for it, because you're dealing with what they call the eye movement, the desensitization response, right? It's a technique that you use for the person who's dealing with the PTSD. So it's different approaches. I like the person-centered approach. That could be someone who just say, you know what, I'm having some relationship issues, and this person that I was in a relationship with, maybe broke my heart, and I'm having a hard time dealing with that. So we're going to use person-centered approach. We're going to sit down with the person, and the focus is on the person, right? I'm allowing that person to be able to express themselves without any judgment. I'm allowing them, it's all about them. I'm allowing them to share their thoughts and their emotions and their feelings, right? And then I'm going to help them by providing them with different types of strategies that could, it's not so much as me telling them or giving them advice. That's not person-centered. Person-centered, again, is all centered around the person. But I am allowing the person to express themselves, but I'm also providing different types of strategies, or I'm using different types of skills in the session that could help bring self-awareness to the person, where they're beginning to be self-aware about what they're saying and about what they're feeling and about what they're thinking. But that approach and the EMDR is two separate approaches for two different types of people. But again, when you think about trauma and you think about being around this person again, how do you feel? Do you feel ashamed? Do you feel embarrassed? Do you feel guilty? Do you feel afraid? For me, again, when I see this person, I have all types of thoughts going through my head that, I want to say some things. I haven't gotten there yet, but I have gotten to the point where I'm actually able to be in the room with the person. So I am making some progress on that. And then let's see, what's another one? Oh, here's a good one. Do you believe you deserved it? Because sometimes when we've dealt with trauma, we believe we deserved it. Well, maybe if I wouldn't have said, if I wouldn't have did, maybe I should have just went along with it. Maybe I wouldn't be in the position that I'm in today, where I'm feeling embarrassed, I'm feeling guilty, I'm feeling ashamed. Do you feel like you deserved it? Because if you feel like you deserved what happened to you, then we have a lot of work to do. We have a lot of work to do. Because let's say, for example, we have this person that wanted to get up enough nerve to ask somebody out on a date. Something as simple as that, right? And the person gave you their phone number. Bad person, bad chick, bad, guy, bad he, she, they, just bad, whoever. Gave you the number, but you never used the number for weeks. And then finally you get up enough nerve when you finally call the number and you get rejected. You get sent to the voicemail. You send a text message and you don't get no response. Then you go out somewhere and you see that person out on a date with somebody else. And you start saying, I deserve that. And somebody else watching may say, well, damn, they did deserve that. Think about what you're saying. I'm going to work with you on being mindful of the words that's coming out of your mouth. To be able to think about what you're saying, hear what you're saying, so you can process what you're saying. So if you're saying, yeah, they deserve that. They deserve that. They didn't call the number. They the one that waited months. And so now they deserve to go out there and see that person has moved on with somebody else. So they deserve to be hurt. They deserve to be feeling as though they're worthless, or they don't deserve to go on another date. They don't deserve to try again. Maybe not with that person, or maybe with that person, or with somebody else. They don't deserve that. They don't deserve to feel good about themselves. Sure. This is me saying it for myself. I've been there, done that. Where I'm like, man, I should have. I wish I would have Because in my mind, I'm like, well, maybe I deserve that. But think about what you're saying. What do you actually deserve? You deserve to be happy. You deserve to try again. You deserve to get back up. You got knocked down. You deserve to get back up. You deserve to see the end result of what this is going to look like. Maybe it didn't work this time. Doesn't mean it won't work the next time. You deserve greatness, happiness, love, peace, joy. You deserve to feel good about yourself. So yeah, but when you ask yourself the question, if you still believe that you deserved what happened to you, you need to really think about that. Think about what you're saying and really process that. Another one says, have they apologized? Will they apologize? What if they never apologize? And these are just a list of questions that I came up with on my own when I began to sit down with different people and they would share their stories with me and they would share experiences, trauma. I began to quickly go into the mind because I'm all about helping people. That's just my personality. So I began to sit down and come up with questions for them that they can ask themselves to actually help them heal and go through the process of what they're dealing with. So going back to trauma, what happened to you? Number one, can you change it? Number two, when you are around that person, when you're in that place, that setting, that atmosphere where the trauma took place, how do you feel? How do you respond to the person? How do you respond to the atmosphere? And then the third one is, have they apologized? Will they apologize? What if they never apologize? You have to ask yourself these questions. If they have apologized, did you receive the apology? What was your response to the apology? How did the apology make you feel? Was it a sincere apology? How do you know it was a sincere apology? Have they tried to apologize? And maybe because every time you see them, you're ducking and dodging them. You're trying to make sure that they don't see you or that you're away from them so they can apologize. Maybe they've tried calling you several times to apologize, but you're so in your head about the trauma that you won't answer the phone. You don't want to answer the phone. You don't want to respond to the text. You don't want to respond to the DM. And hey, listen. This is your trauma, not mine. So if you feel like right now, I don't want to deal with that. I don't want to call them. I don't want to hear their voice. That is your right. That is your right. What I'm saying to you is that I don't want you to sit in that space where days, weeks, months, years have gone by and you still sitting there dealing with it. Because at some point you're going to have to face that trauma. If you want to, it's your choice. But if you want to move on from this place, if you want to see a better you, if you want to get a better job, because the trauma right now is affecting you on your work, and affecting you at your workplace. You sit and eat lunch by yourself every day because you don't want to sit around certain crowds because they remind you or they trigger you. Or you're snapping and going off on somebody that haven't done nothing to you, but they look like maybe somebody that did something to you. Trauma. You can't function on your job. You can't function in a relationship. You can't even sustain a healthy marriage because you still dealing with what the last husband, wife, partner did to you. So ask yourself these questions. And again, I have a whole list, but these are just a few that I want to share with you today that you can think about. So think about these things because, again, it can really help you heal and process the things that you've gone through. Now, let's do one more. Let's go with, how has this affected your life? The trauma. Going back again, the example about your workplace, your marriage, your relationship. How has this trauma, how is the trauma affecting your life today? Ask yourself the question. Start writing this stuff down. Start looking at the patterns. Also, how is it affecting your career, your business, your family, your friends, your relationships, your physical and emotional being? These are just some strategies, some tips that you can sit down and write down and ask yourself and actually write this stuff out. So, because I'm a visual learner. So when you write these things down, you can actually visually see your answers and your response to this. That's a part of processing this trauma. It's a process. It's not going to happen overnight. When someone comes and they, want to have a session and we on, first session, week 1, we're just going through an assessment. I'm just assessing who you are, your background, your family history. I'm assessing, why are you here, so that when we have our actual first session, now we're digging into it, we can begin to work through whatever it is we need to work through when it comes to your health, your mental health, your stability, your being, your life. So everything is a process. But these are just some tools, some strategies that I wrote down that I like to share with my clients so that they can get an idea of, where they are in the process of processing their trauma. So let's talk about a little bit about self-care. Now, there are different types of self-care. And when we think about self-care basically is you being intentional about caring for yourself. You are purposely doing something to contribute to your emotional, your physical, your mental, just, all of those things that pertain to you. That's literally all self-care is, as far as when we want to define it, right? You're being intentional about your care, about your emotional, your physical, I want to say your sexual, because even sometimes you think about, as a person, you have these needs, you want to explore intimacy, right? Yeah, there are different levels of self-care, believe it or not. But again, and your spiritual as well. But when we're talking about, let's talk about our emotional self-care. We talk about our emotional self-care. It could be dealing with, I'm going through a list of things that I have written down. It could be something dealing with repetitive positive affirmations, right? This is emotional. Thinking about your emotional, your feelings, things like that. Self-care could be dealing with positive affirmations. It can be dealing with creating an inspirational collage or a Pinterest board. Yeah, emotions. It could be dealing with practicing breathing exercises. Some people would do the breathe in for 8 and then hold it for 4 or 6 and then breathe out for 8. Or some people will breathe in for 6 and hold it for 4 and then breathe out slowly for 6. But again, breathing exercise, all this is dealing with your emotions, right? The mind. We can be talking about writing, journaling. It could be poetry. It could be writing a book. How does that make you feel, dealing with your emotions? It could be allowing yourself to express all of your emotions in a safe environment. Emotional self-care. It could be something like refraining from being overly critical of yourself. I'll never do this. I'll never amount to that. Man, I just look ugly today. And I'm fat. I'm skinny. I'm too black. I'm too pale. My hair is too this. It's not you just critical about yourself, right? So emotional self-care, we want to think about some things that we can do to improve that. Decluttering or cleaning up your living space. Emotional self-care. If you're living in an environment at home and you got clutter, your closet's cluttered, you can't even, you can't, see which shoes you want to put on. You don't know, where to find a clean outfit because clothes are thrown everywhere. You haven't taken things to the cleaners. You have a laundry room full of dirty clothing. You haven't gotten up to wash the clothing. Your room is a mess. Declutter. We're talking about emotional self-care. These are things that you can do. When we're talking about mental self-care ideas, you can do things like avoiding toxic people. That is a big one. I've had to do that. Avoiding toxic people. People that mean you no good, that serves no healthy purpose to your life, to your right now, to your future. Right? Toxic people, always negative, always got something, bad to say. I always got something evil or something that's just, judgmental. They just toxic. They just trying to find things to bring all of this, this darkness to your life. to your conversation. You know, they call you and everything is always about something bad and, you know, nothing good. The conversation never changes. They're just toxic. Yeah. When you want to talk about mental health, self-care, yeah, we want to talk about changing our atmosphere with toxic people. You can also talk about practice saying no. Oh my God. Practice saying no. That was a hard one for me. When I'm dealing with, we went through emotional. This one is talking about mental self-care. Saying no. That was a hard one for me because people call, you know, oh, I'm having this event, you know, can you come? And I said yes. And then there's another event that same week. I'm looking at the end of the week and I've gone to 4 events. And really only one of them I really want to go to. But you don't want to say no. You don't want to disappoint them. You don't want them to, you know, to feel like, you know, they're not worthy or they're not valuable. If they know you, and you say no, it should not affect them to the point to where they stop calling you. Or now they're talking about you. Are you the bad person? If you know me, know me. If I don't want to come and I say, you know, I thank you for the invite, but I'm going to have to decline. They should be able to maturely accept that. And if they don't, is that on you or on them? What did you do wrong? You don't have the right to just do what you desire to do. Yeah, it's okay to go to the events because you want to support your people, your family, your friends, your loved one. But every time, it's okay to say no sometimes. We can't take care of ourselves because we're so busy saying yes to everything. And now we get to the end of the week and we're exhausted. We're tired because we didn't want to say no. So yeah, that was a good one for me for my mental self-care. Let's find one more. Oh, unplug from technology for at least an hour. Unfortunately, that is very difficult in this day and time for some of us to unplug from our technology. I'm going to turn my cell phone off today and I'm going to put it on airplane mode. I'm going to put it on do not disturb. I would have friends that would call me and literally tell me, girl, put your phone on do not disturb. Put it on airplane mode because they knew that I was that one that everybody can call anytime. I'm laying with my phone next to me just in case somebody, hello, who does that out there? You lay down in your bed and you have your phone right next to you just in case somebody call. I want to make sure my daughter get home safe. I want to make sure my son's okay. I want to make sure my boo good. I want to make sure this. I want to make sure they got access to. Yeah. It's okay to turn your phone off for at least an hour. I tried that and my God, the amount of freedom, the amount of stress and tension I was able to release from myself just by turning my phone off. And doing that during that hour, I was able to do something that I enjoyed doing. I was able to go for a walk. I was able to sit and watch my favorite show on TV. I was able to sit and, you know, go get my nails done, my toes done, or even my hair done. You know, I just by turning my phone off for an hour. And when I turned it back on, nobody had died. Now listen, because I don't want to trigger anybody. So if that has happened to you, I am terribly sorry if that happened to you. But again, I don't want that to dominate and dictate and control your life. You have to keep living. You have to keep going forward. So it is okay to turn your phone on because, and I'm speaking from experience, I went through that. And when I got a phone call that my son at the time, who was 19 years old, had just graduated high school a year before, I got the phone call that he was gone. Yeah. And every day I had my phone next to me because I'm like, well, I gotta make sure my daughter's okay. So let me sleep with my phone and wake up with my phone because I don't want to get no phone calls. You know, the phone, somebody call you at 2, 3 o'clock in the morning. You just like, hello, what happened? Huh? Who? And they're like, oh, I'm sorry, girl. That was a butt dial. And you like, But you all on edge. So it's okay. It's okay. Turn your phone off. Relax. Breathe. Rest. Let's see what else we got. Let's go to physical self-care. So we talked about emotional self-care. We talked about mental self-care. Now we're going to move on to physical self-care. Physical self-care looks like start stretching. Stretching, yeah. Get up in the morning. Stretch yourself. I went to the gym today. That's why I have on my gym clothes still. I put on my Lululemon. I like Lululemon. I didn't think I would like them, but it's very comfortable. I love the way it feels on my body. But I went and worked out with my husband this morning, and I came right in here like, let me go ahead on and get this recording done, because again, I said I was going to do something, and I'm going to stick to this, and so I want to make sure I got my video out there for you guys. But yeah, physical self-care, stretching. What else? Oh, do some yoga. Yeah, yoga. For those of you out there who is in this mindset, I'm a Christian, I'm spiritual, I'm, pastor so-and-so, or I'm evangelist so-and-so, I'm prophetess so-and-so, whatever. That's lovely. And we honor you. But please, let's stop saying things like yoga. That's a sin. Yoga is, an abomination, and you're going to go to hell. Because I've heard this. When I was younger, I would see people stretching and doing yoga, just breathing. And I was in church at the time, or the church I was going to at the time. Really, I allowed them, like I said, they made me, but I allowed them to plant seeds in my head that yoga is a sin. And now I'm a therapist, and I'm looking like, breathing is a sin? Stretching is a sin? Clearing your mind is a sin? Because some people look at it like, when you're doing yoga, you're out of your, you're trying to get into another place where, you're out of body, or you're, I don't know, thinking about some higher self or whatever. Listen, read a book. Stop just saying stuff that you don't know about. Okay? That's not true for everybody. Now, if somebody is worshiping something and they're making that more important than whatever they believe in, because everybody don't believe in God. Let's just be real. But for me, who does believe in God, me doing yoga, I'm not going to hell because I did some yoga. I'm not. I don't live in those lies anymore that people tried to feed me over the years. I don't live in that lie. When I do my yoga, I'm doing breathing exercises. I'm stretching. I'm clearing that clutter from my mind. I'm meditating on things that are good and pure and lovely and of good report. If we want to go to the word. Just saying. I told y'all I'm about as real as it get. I'm not on here trying to fake and shake with nobody. I'm gonna keep it real. But again, this is a no judgment zone. So do you. If you believe yoga is a sin, then I'm not here to debate with you. That's your belief. Yoga for me is not a sin. And it works for me. Okay. So that's one physical self-care. That's two. We talked about exercising and we talked about yoga. Another one, staying hydrated. Yes. What? That's physical self-care. Absolutely. Staying hydrated. I keep this thing filled with water to remind me. Take care of your physical health. I will be 50 years old next month, and I am looking forward to it. I am 50. Well, wait a minute. Oh my God. Okay, y'all, I just had an aha moment. Oh my goodness. I just realized I am going to be 50 years old next month, March 26th. Woohoo. Shout out to my Aries out there. And I'm just about 50 pounds down. We'll talk about that in another video where I'll show you guys some before and after pictures. But those that know me, girl, your face is slim and you lost a lot of weight. I have. I was 214 pounds. 214 pounds. I am now at almost just about I'm like what? I was 167 this morning. What? Yes. I just realized, oh my God. 50 pounds, almost 50 pounds down. And I'll be 50 next month. My best friend told me she did. She was like, shout out to Stephanie. Hey girl. But and I have multiple best friends, and we'll talk about that another time as well, because yeah, you can have more than one best friend. Best friend is somebody that you can count on, you can call on no matter what. You can get mad, be angry, whatever, and it could be weeks, months, whatever. Y'all come back together and it's just like, okay, you know what, girl, we act a fool. We both was wrong. Let's just talk about this best friend. Okay, but this particular best friend was like, 50 is the number of Jubilee for you. It's going to be the year of Jubilee for you. And I received that, and I believe that. I just like, wait a minute. I'm going to be 50 next month, and I'm almost 50 pounds down. Thank you, Manjaro. Yes, girl, I used Manjaro. It worked for me. Again, this is a no judgment zone. If you knew my story about how I tried to lose weight since 2014, you won't be judged me like, oh, she used Manjaro, so she used a cheat route. It's not a cheat route. And it sure ain't a cheap route. Oh, bless the Lord. But it was the route that my primary care provider, my PCP, recommended for me and put me on. And it has worked. I am almost just about 50 pounds down. So I'm excited about that. Yeah, 50-50. Okay, my year of Jubilee. Let's get back to it, Kimberly. Let's do one more physical self-care. This one says a forest bath. A forest bath. Now, this one is new for me. I haven't done that one yet. Okay. But again, now wait a minute. No, I haven't done that particular one. But I have drawn me a very nice hot bubble bath. Calgon, take me away. And gotten into my bubble bath, and I have sat there and just allowed my mind to just release the worries of the day. But that nice bath, it helped. So those are just a few physical self-care. Let's see if I have one more. Oh, dance. If you watched my TikTok video the other day, yeah, I put on my Alexa, and some of those old school songs came back up, like Lisa and Coat Jam, baby. I was dancing. I love dancing. Is therapeutic for me. So yeah, if you want to dance around your house or go dancing or go out dancing like I love to do, that's a good physical self-care. And then sleep in. It's okay. If you got nothing to do today, you have to go to work. Even if you got to do something today besides work, you got to go run some errands. Sleep in for a little extra 30 minutes or an hour. It will make a difference in your life. And you can also try acupuncture. That's another form of physical self-care. So those are just a few things that you guys can do. Again, on my first episode, we talked about trauma, what trauma is, what it looks like. And I told you I would come back and give you some strategies and some tips to process and deal with trauma, as I hope I have done today. Giving you those 3 tips. There's a lot more I can give you, but I don't want to, we'll be here forever and all day. And you got things to do, and I got things to do, and I respect your time. I know you respecting my time as well. So we on the same page. But I hope that this video helped you guys. I hope you guys, made some little notes and wrote some things down that you can go and apply to your everyday life. I will be coming back to you guys again. Click the subscribe button. Again, I am excited for my 6 subscribers. I went from 1 to 6 in a week, so I'm excited. I celebrate all things. This is what, baby, here we celebrate all things. And they're too small to celebrate, okay? And again, my website, thereislifeafter.org. I had to think about it. I think I said life before, but my website is thereislifeafter.org. If you want to learn more about my background, my education, my trauma, my experience with loss, what I do, then you can go to that website. If you want to just continue as well, I want to encourage you to subscribe to this channel. And I'm going to also be bringing you more videos on a separate channel that I'm creating that's just all about lifing. It's called Lifing with Dr. K. And on that particular channel, I will be allowing you to go through my everyday life. When I go to work, you won't be able to come in there with me when I'm doing my sessions with clients and stuff like that. We can't do that. But just, maybe me getting ready for work, what that looks like when I get off work. How do I feel? What do I look like when I get off work after I've dealt with clients all day? when I go to the store shopping, the types of things that I buy, since I am now just about 50 pounds down, I have to change my lifestyle when it comes to the things that I buy when I go to the store. I can't eat, I can't buy the whole pack of cookies. I can maybe just get a cookie from the bakery, even the butter that I buy now, it's a different type of butter, so it's just, again, it's called Lifing with Dr. K. I'm working on that because people have said, other than, your career and, people that know me know I'm all things mental health. I'm a huge advocate of mental health, but they also know that, baby, I'm about as silly. I'm about as real. I love dancing. As I said before, I love family. I love spending time with my family. I'm married to my soulmate. You'll get to see him on my other channel, and you can get some relationship advice. I'll talk to you about our marriage and, how we came back around full circle, because I went through 3 marriages and divorces before getting to my soulmate. Yes. So on that particular channel, we're going to talk about relationships, and we're going to talk about me and my husband, and I'm like he here right next to me. That's how close we are, though. And some, yeah. But we're going to talk about our relationship, our marriage, and we're going to talk about me turning 50, and y'all get to see me, turn up and put my little outfit on that I already got picked out. I'm excited about that. You get to see, my daughter, my son, my grandson, my granddaughter. Yes, I am a cami. Watch my first video. You can understand what is a cami. Go watch video number 1. I tell you what a cami is. Okay. I think I do. In case I don't, because I don't remember. In case I don't, cami. My name is Kimberly. I am a grandma. I'm also a mommy to my grandkids. I kind of feel their role as well. I feel like I do. So I took Kimberly and grandma and mommy, and I came up with Cammy. I'm their Cammy. Some of y'all got, Gigi and, glam mom and all that. I'm a Cammy. I'm all those things in one. I'm the mom, I'm the grandma, and I'm Kimberly. So I'm Cammy. But yeah. So you get to go through my life and just, get to see the other side of me other than this. This channel right here will be specifically for dealing with therapy, because again, this is my new life now. This is what I do. This is my career, and I love it. So thank you guys for joining me today. I hope to see you soon on my next video. And again, make sure you subscribe and hit the bell so that you can be aware of when I come back with new content. Thank you so much for following me. Have a great day. And if you wrote some things down, choose one to do today. Emotional self-care, physical self-care, or mental self-care. But choose one just for you. Be intentional about your self-care.